If you think about it, since 1930, this philosophy started really gaining ground. It was a philosophy as a community engagement method, right? Where you would have, community meetings, supporting people locally, people coming together to help one another, try to come out of this horrible disorder, which was inspiring and, good intention, right? But in many ways, over time, it has evolved into something that, in fact, for many, at least for some, can cause harm. And so when you stand back and look at the progression over these 90 years or so, it's been widely adopted because very quickly after it started getting into communities, they also started presenting it institutionally, and they were bringing it to organizations that were trying to figure out how to treat these, patients who had these problems. So it became an institutional method where rehabs and other, paid facilities are actually making use of 12-step as the methodology, as their core philosophy and methodology for treatment. And once you institutionalize something like that, and a country sort of gets behind, okay, this is how we do it, since there are no other alternatives, right? If you walked up to 100 people on the street and said, if you had a loved one struggling with this, what would you do? What would you recommend? They'll all tell you, well, they probably have to go to AA. And if they're going to AA already, or if they haven't been, but they're really not doing well, they may need to go into detox, or they might need to go into rehab, right? These are what people widely know are the treatments available today, because there hasn't been an alternative. And so when people go to AA, because it's widely believed that it works, right? Most people think that AA works. So they think they're offering something helpful. But it's not widely known that it's only successful in 8% of people. That's in the literature. And in fact, that's held up even further by the fact that since rehab has institutionalized this, since it's their fundamental methodology for how they deliver care is to have patients come together and work 12 steps in a group, it confirms that that method doesn't work well because rehab success rate is 13%, right? And so if they're using that methodology, perhaps the only gain they're having from the 8 to 13% is that people are kind of forced to stay and stuck with it and do it all day long for 30 days. I mean, they don't do it that intensively in the community. And they're also, not able to get alcohol. So of course they're not drinking. But, 84% of those people return to drinking within 6 months. More than half of them return within 30 days. So it's not a treatment, it's a support group.